listener production.
Hi, Natarsha Belling with you and welcome to the afternoon edition of The Briefing. Coming up in our deep dive, why the tragic death of an AFL superstar has put mental health back in the spotlight. A leading psychiatrist joins us on his solutions to how we can help prevent suicide and the crucial role we all play in connecting with others. But first, let's check the afternoon headlines this Monday, the 19th of May. Qantas is back in court for illegally outsourcing more than 1,800 workers during the COVID pandemic. The airline could be forced to pay more than $120 million in penalties. Michael Caine from the Transport Workers Union says they're pushing for the tough fine.
We have to send a very strong, clear signal to Qantas and every other company in Australia that this can never, ever happen again to any Australian worker.
Chilling new details have been revealed about the execution-style murder of a Sydney mother last month. It's being reported a Vietnamese drug cartel allegedly kidnapped the 45-year-old and also attacked her children inside their Bankstown home. It's believed she was later shot and her body dumped in a burnt-out car. Police now believe the kidnappers sent her husband countdown to murder ransom messages before they killed his wife over outstanding drug debts. And Joe Biden is reportedly reviewing treatment options after the former US president was diagnosed with an aggressive form of prostate cancer. Doctors say it has spread to the 82-year-old's bones. Now it's time for our deep dive over the sudden death of former AFL player Adam Selwood. He passed away just months after his twin brother died by suicide. The death devastating the Selwood family and the entire AFL community. With mental health now back in the spotlight, we speak with Professor Steve Moylan from Lifeline about the action that is so desperately needed in our society and how we can all help those in need. And a warning, this following interview contains themes about mental health and suicide. Steve, thanks so much for joining us. These very sad circumstances surrounding the sudden passing of former AFL superstar Adam Selwood. Our thoughts are with the Selwood family and the entire AFL community. This very sad death has firmly put mental health back into the spotlight. What are your thoughts?
Thank you very much for having me first and foremost. It is a really important discussion to be having. I think there's no doubt if you ask anyone in the community, mental health is of increasing concern at all levels of our population. I don't think there's anyone who's untouched by the impact of poor mental health or suicide. And I'm constantly struck in this role with Lifeline that the amount of people who reach out to me or speak to me about their experiences of having a loved one, a friend, a member of their community pass or die by suicide, I think it is something that is obviously, ever present in our community and clearly something that we really need to work together on.
Steve, in regards to we've come so far over recent years, we're now talking about mental health. We've got Are You OK Day. But it seems when you look at the statistics, we're not seeming to really be able to tackle mental health and suicide as a result. What do you think is going so wrong?
I think we have two things happening at once. I think there is a lot of fantastic work going on by a number of organisations and people to really work against some other forces. So I think, lots of people are doing fantastic work around raising awareness. There's great treatment programs available. There's a variety of communities working together to really support other Australians. But I think we also have to recognise there are other forces going on in our society. I think the information age and the rise of social media and the internet has changed the way we interact. There's increasing issues in relation to people, the cost of living and other sort of potential issues there. So we're kind of working against it. So whilst I wouldn't say things are going so wrong, that's not how I'd characterise it. I think that the need now is much greater and we have to strengthen our efforts more than we probably ever had before to get the outcomes that we're looking for.
So do you think we saw this amount of mental illness in our society beforehand and it's just that it was not recognised or misdiagnosed or no one spoke about it? Or do you think it's actually worse today? Is it an element of more people are being diagnosed and talking about it? It's always been there?
I think if you look at suicide statistics over the last number of decades, you'll actually see suicide rates have come down off historical highs. And there are periods of time where suicide rates do noticeably drop, and they're usually around times of, national unification. So the war days, as an example, is a kind of example of that. So we've seen some fluctuations with this, but ultimately we've seen a trend downwards. What we have seen in the last decade, though, is that kind of starting to tick the other way. So it's sort of difficult to know exactly why that is, but I do think it does relate to some of these new changes to our society and the way we have structured our society not being in keeping with preventing suicide in the end. So all of the efforts we're putting in, I have no doubt are making a difference. The issue is that they're not making as much of a difference as we really want them to make. And so that's why I think it's ever more important now, where there's opportunities to increase to raise awareness, to change the conversations and to invest in methods to prevent suicide. We should be doing this now.
So, Steve, we send our absolute thoughts to this poor West Coast Eagles family, their entire community, and also the Selwood family who have lost 2 sons in all of this. Unimaginable for that poor family to deal with. You mentioned before about that this puts mental health back in the focus. Some people have called for an AFL mental health round after Adam passed away. Do you think that is a good idea?
Yeah, well, the way I'm a psychiatrist. I've treated lots of people in this situation. I've been with lots of families in this situation. And over time, you develop a bit of an understanding of how someone may get to this position. I've always understood it in sort of really simple terms as 2 kind of things that happen at once for a person that may lead them to contemplate suicide. The first is the sense of them feeling a burden in some way on others and people around them. But that in and of itself isn't necessarily enough to drive that. The second thing is this idea of that overlapping with a sense of disconnection from others, a sense of being alone. And it's these 2 things, when they happen together, that can be the cause. So what I've always talked about with other people in clinical practice or myself is that if I can be with a person at that time and improve that degree of community connection, that has a direct impact on the way someone is thinking about contemplating taking their life. So translating that to a broader community level, if institutions like the AFL or any other community program dedicate some time and some thought to how they could raise that level of community connection by promoting conversation, by promoting actions to improve community, I'm all for it. And I don't see it at all as tokenistic or other things. I don't think it's the whole solution either. I think there needs to be efforts, made beyond that around how do you work with someone around whether they're experiencing a mental health issue or whether other issues that led them to feel that burdened way. But at the same time, if we can be encouraging all of our institutions around us and all of our community to come together to create that sense of connection and invite people who may be more disconnected to come into that fold, I truly believe that's a pathway to reducing the amount of people who ultimately die by suicide.
I think you make an excellent point there, Steve. There's a lot of research coming out about the importance of connection. Now, in the world that we live in 2025, apparently, according to social media, we're more connected than ever. But when we talk about real life, meaningful connections with people, whether that's family, friends, colleagues, we've actually seen a massive decrease in that real life connection, haven't we?
Yeah, ultimately that's what we're seeing. We see that play out in Lifeline every day. We get about 4,000 contacts a day from Australians, whether that's through via our phone services or digital services, text and chat. And one of the most common reasons is a sense of people being lonely. And they're ultimately looking for that real human connection with someone to reach out for that support. And that's where they're coming to. So I believe there is an epidemic of loneliness going on in our society. And I think most people will recognise that. We are more technically connected than we've ever been. But I don't think necessarily that's translated to us feeling a sense of connection that we've previously had. We need to really think about that, I think, as a society, and what are the steps we're going to take to kind of reverse that trend.
The other really big issue for mental health in our country and for many people who may suffer episodes on a regular basis or have had a lifelong struggle with mental health is the fact that there's a couple of issues, especially for people in regional and rural areas. They can't get access to great services. And the other issue is we know in many circumstances the medical system's broken, but it's unaffordable for so many people to go and seek help. What do you think are some of the tangible solutions to be able to break down those really serious barriers?
Yeah, I mean, I always come back to this idea that at Lifeline, we want to be a safety net for people. You know, if they're in really distress, you can call us 24/7 hours a day. There'll be someone here to be able to help and support you. But a safety net doesn't lead you to live your best life either. We want to change people's trajectories in the long term so that they look back on this day and 10 years ago and I'm glad I got caught by the net and that was the turning point for me and people helped me after that. To achieve that, we need a couple of things. We need access for people to receive care, the types of care that they need. Not every person needs to see a psychiatrist, no doubt, but some people do. And if we can improve access to that, that's really important. We also need, in my view, to help make the system a bit simpler for people. The system at the moment has grown up quite organically in its design. And I know governments across Australia are wrestling with how can we make the system more simple and easy to access for people and looking to connect the system together in a way that's quite cohesive would be really important. One of the challenges of this is that this isn't easy. If it was simple, it would have been achieved by now. And there's lots of different opinions about the best way to do that. But I am encouraged that governments appear increasingly interested and understanding of the need to invest in mental health services, not only just because it's their obligation to do so, but they also see it as an investment because mental health disorders often occur in the early years of life. If we can work through that with people, then they can go on to be positive, productive citizens for the rest of life. So it's a really important investment for our community to make, but also just really important because we all want to live happy and healthy lives.
For you and for many of us that were shocked and saddened by this horrific news, re Adam Selwood, and of course just months after his twin brother Troy also died by suicide, if someone is listening to this today and they want to know either they're not okay or someone they love is not okay, what are some of the simple takeaway messages you can give someone today?
The first message I'd give everyone is that you're not alone. There are services available right now. Lifeline is one. We operate 24/7. We have people across the country, volunteers and paid staff ready to answer your call, read your text message, respond to a web chat. And I just encourage everyone to take the first step to really reach out because sometimes that's all it needs, just to hold. I think the other thing that people, family and friends often worry about is I'm worried about someone, but I'm worried I'll do something wrong or I'll somehow make a mistake. And I just want to reassure someone, I've been in this area a long time. You cannot make a mistake providing positive support for someone. It's impossible. If you reach out to someone and say, I genuinely care, I just want to let you know that I'm here for you if you need, that can sometimes be the thing that changes someone's trajectory in their life because it's just at the right moment, at the right time where things may have been slipping down a dangerous direction and they've reverted back. People don't always feel comfortable getting support. That's okay. But at the end of the day, I've spent so much time with people who said, I was trying to push these people away who kept on coming to say that they were here to support me, but what they did for me was so important. So I just come back around to it's simple. Reach out to support, check in on people, create that connection and maintain it. And if you yourself are feeling alone and isolated, we are always here for you as one service to help you.
Really important, wise words. We really appreciate you joining us today, Steve. Thanks so much.
Thanks so much for having me on such an important message and important day.
That was Chair of Lifeline Australia, Professor Steve Moylan. And if you or someone you know needs help, you can call Lifeline and that number is 131114. And that's it for this episode of the afternoon edition of The Briefing. We'd love you to subscribe or follow us on our socials on Instagram at The Briefing Podcast. And we'll be back in your feed tomorrow at 6 a.m. I'm Natarsha Belling. Thanks for your company.